brain-friendly change. AI and good leadership together can reduce uncertainty. Personalized support. We've got the technology to use it to frame, how do I help this group of people? How do I get them involved in this? How do I track how people are feeling in relation to it in real time? Get it to simplify the complexity. Provide timely reassurance. Are we engaging with people in the right drumbeat of activity to make sure that they're with us on the journey? Spot stress early. How do we identify when people are triggered by the change? And how do we reinforce confidence in people? So these are some of the things that we can actually use the AI to help us to create, to curate, to engage, to analyze, to thematically assess, and to help to predict. Results, more people stay in the online learning focused state. And that's what we're trying to achieve, getting more people online and taking them on the journey with us. So how are we doing for time? Okay, I want you to take you to your happy place. So this is a brain chemistry experiment, by the way. We're just going to test this out in real life. I want you to come with me, Lynn. If you want, you can turn your cameras off for a moment so that you're doing it in the peace and comfort of your own environment. If you're in the office, just ignore the folks around you. And I want you to, for a moment, to close your eyes, take a deep breath in, slow, long breath out. Do that again. Deep breath in, slow, long breath out. And I want you to picture the place where you are most happy. Create that image in your mind, bring it to the fore. What does that place look like? Who's with you? What are you doing there? How does it feel? Is it warm? Is it cold? And just let yourself go to that place in your mind. If you're someone that's not good at visualization in that way, think about a scent or a smell that really evokes something positive for you. And just take a moment to let yourself soak up that vision or that scent. And again, take a deep breath in. Long, slow breath out. Okay, and open your eyes. Switch your cameras back on, if you please. Thank you. So, how did that make you feel? Comments in the chat, please. Relaxed, happy, relaxed and optimistic. Good. Calmer, chilled, centered. Nice. Relaxed, happy, and warm, peaceful. That's amazing, isn't it? Nothing fundamentally changed. You're still the same person in the same place, in the same situation. And what it is, it's the opposite of what you were doing when you were watching a horror movie. This is the positive brain chemistry experiment. This is about getting to a place where you can create your own positive brain chemistry. You just created a dose of serotonin and oxytocin for yourself because you're able to visualize the thing that generates that for you because you took yourself to your happy place. So not everybody can do that, but there are often associations with smells that create positive associations as well. So things like cigars smell like Christmas to me. So because that was the only time my dad ever had a cigar, and so that makes me think about Christmas, which is a lovely thought. So think about what kind of state you are in when you're engaging people in change, but also what state do you want to create them in, and how can you cultivate an environment that allows for that positive engagement? So well done. That's great. So let's move on to the next question. Thinking then about what we've talked about so far and what you would like to see happen, but also what can positively or negatively engage it. What activities could we do to improve embedding digital change in a fun and effective way? Oh, hang on. Oh no, I've lost that one. Oh, ideas in the chat. Sorry. I'd originally put it in Menti and then changed my mind. So put your ideas in the chat so everybody can read them. What can we do to make it more fun, more engaging, more positive, to get people involved in the change, to create those positive brain chemicals that gets them cognitively connected and online? Share your thoughts in the chat. Cake is a great place to start. So once we've created that positive environment for change, we've got people connected and bought in and positive about it, how do we make change stick? We talked a little bit earlier about the neuroscience for change, and this is then about those new neural pathways. When I said about you can teach an old dog new tricks, you can, but the older you are, the harder it is to build new neural pathways, so it's a bit slower. Might need more repetition, might need a bit more motivation. So what are we going to put in place for those people that might struggle to engage and to learn the new thing that we need to get them involved in? And this is how I kind of picture old and new neural pathways in my head. If you've been doing something for 30 years in a particular way, you can do it quickly, efficiently, speedily. It's like a motorway. It's long, it's smooth, it's straight, it's fast, because you've built a really strong neural pathway that allows you to do that activity on autopilot. You don't have to think about it. You just have to do some minor tweaks and you can go as fast as you like. And then you ask people to do something completely different. And I live in the country and a lot of roads look like this around here. And if you've not been down that track before, you're going to go slow. It's going to be bumpy. You're going to be gripping the wheel with all the tension that you can. You're going to be looking out for other rabbits or sheep in the road, or what's around the corner. Is there a tractor barreling towards me? It's going to be slow, it's going to be energy draining, and it's going to be exhausting. If you were having to do that for a long period of time, you'd be exhausted by the end of it. And yet we're surprised when people twang back to their old ways of working. When we present something new, we've given them a half day's training course, right? Okay, crack on. Off you go, get on with it. And then the next time they come to it, going, well, I can't remember what direction I'm supposed to go in. But I remember how to do this really easily, and I haven't got time to go back and do that. Actually, I'll do it the old way. I'll come back later and I'll put it in the new system, or I'll do it the new way when I've got more time. But actually, that's really difficult to do. Change sticks when new pathways are strengthened and old ones are allowed to fade. You have to allow those old ways of working to stop becoming the autopilot way we do things. What gets repeated gets wired, literally in the brain. What gets ignored gets retired. How quickly, when we move on to a new job, do we forget what we used to do in the old job? Because it's redundant information. We don't need to know it anymore. We've cleared it out of the cache. It's not relevant. This is what we need to do when we are teaching people new ways of working and new behaviors and new capabilities. We need to put repeated effort over and over again to build that new neural pathway and allow the old one to fade away. You've seen pictures of motorways that have been left to they soon break down if they're not maintained. You know, the plants growing out of it, the trees are kind of breaking through the concrete. This is what we need to create for ourselves. So what do we do to strengthen new neural pathways? So repetition thickens neural connections. Practice speeds up recall. Microlearning reduces overload. Feedback reinforces accuracy. Are we being accurate about it? Recognition releases dopamine. Well done, you did a fantastic job. That's brilliant. Woohoo! Yeah, pat on the back. Peer modeling activates social learning, get people to come together and do it. Daily use, supported practice, reinforcing it, reinforce workflows, visible success stories. All of those things will help people to build stronger new neural pathways. So that's half the journey. Those are the things we need to put in place to get people adopting it and building it as a way of working. And how do we let the old pathways wither, starve the old habit? Remove legacy access so they can't go back and go, well, I'll just do it the old way and then I'll come back to the new one when I've got more time. Stop rewarding old methods. Because if you stop giving people dopamine for a job well done in a way you don't want to do it anymore, well, they're less motivated to do it. Change policies, make sure that you've got the policies supporting the way that you're doing things. This is actually what that we require people to do now. Redesign processes. We talked earlier about the fact that a lot of the systems are kind of basically doing the same old processes, but just on a new system. How do we design it so that it actually makes it harder to do the old thing, but also delivers greater value? And redirect leaders, prevent mixed messages, make sure that we're telling the right story and everybody's telling the right story. So in practice, retire the spreadsheets. Yes, don't let them hold on to those. They will. They'll squirrel them away. Switch off parallel systems. Stop accepting workarounds. That's a classic case of, makes me judder every time I hear the word workaround. Oh, we've got to work around. Doesn't do what we're supposed to do, but we've got to work around. Align performance measures with that success so that people are rewarded for doing the right things. If you keep feeding old habits, they won't die. Those on your pathways will keep going. So, moving on to the last question then on Menti. Oh, hang on. Let me go back one. What one action are you going to take away after today to improve engagement in digital change? What can you do? You may be leading it. You may be running a function where people are needing to change how they do things. It may be about you. How are you going to change how you do something? Let's capture that thought, and I want you to take those away as an action. So let's see what people are putting in. Look more into neuroscience. Absolutely. The insights are really valuable to help you understand how we can engage with people in a positive way and shape the way in which we do it, so we're not unintentionally negatively impacting people and their mental health. We're not causing them to be traumatized by the change. Use the paths analogy. Organize an in-person training session. Yes. Make it inclusive, interactive, and fun. Yes. When we're thinking about this, are we being inclusive? Are we including the people who are on sick? Are we including the people who are part-timers? Are we including people who are on maternity? How are we making sure that they feel engaged and connected and valued and part of it? Linking with change management specialists, absolutely. Yep. Setting the scene is so important. You need to think through how you're going to approach people before you start announcing things. How do you create that positive, energetic, and excited engagement in the change? Buy cake, yes, buy cake. It works, promise you. Before moving into the NHS, I did a stint at Department of Health for the Chief Health Professions Officers, and one of the things was business planning. And the head of business planning was bringing people from all over the country, all the regions, to come together. And there was a lot of chuntering. People weren't happy. It was stressful and painful. And he came in and he brought this big tray of muffins. And he'd baked these muffins himself. He's like, oh, I baked some muffins. And I thought it'd be just nice for everybody to have muffins. And everybody in the room just thought, oh, isn't that lovely? He didn't have to do that. But it was a really nice thing to do. It was, a generous and thoughtful thing to do. And it just turned the dynamics in the room. He didn't do it deliberately to influence people, but actually it worked. People thought and it made a connection. It made people see him as being, he's not just the person doing this to us. He's the person who's thinking about us and the fact that we're struggling through this. Cake makes everybody feel better. Interactive workshops, yes. Standard operating procedures. Yes, use examples. These are fantastic. There's lots here to take away. So hopefully you will take these away for yourself to go and do. We can share some of these afterwards and maybe give you some ideas of things that other people have commented on and maybe have a think about, make a connection. Okay, fantastic. So, oops. Just lastly then, in terms of conclusion, the future of digital change leadership, thinking about this from an AI perspective. Digital transformation is not about installing systems. It's about rewiring how thousands of brains do their work. What do we think about that? Do we agree with that? The future belongs to leaders who understand that digital transformation is not primarily technical, it's neurological and behavioral. Now, this might be a bit more controversial, but neurointelligent change represents a new discipline of leadership, where AI provides the intelligence, the information, neuroscience provides positive change design, and people deliver the results. Because ultimately, this is what we're doing. We're changing people in response to this. And you don't have to take my word for it, take Chuck's word for it. Chuck is what we call ChatGPT, because we created some of this together. And the effect is an emotional response, a human response that we have connected with here over examples that are very human. But actually, the AI and the technology can help us to do that change really effectively. I might have to rename Chuck, though, because I asked ChatGPT to create an image of itself. And this is the image it came up with. And I'm not sure whether to be impressed or slightly creeped out by it. But it'd be interesting to see what happens if you ask your AI tool what it looks like and get it to create an image that for you. Because it'd be interesting to see whether or not it gave us an image that it thinks that we would respond to. So that was the end of my content. I kept track of time terribly well. So Suzanne, I don't know if we are I'm under time.
No, that is that's absolutely perfect, Jo. Thank you so much. Everyone's probably leaning off in terms of getting some cake now as well.
Yeah. Who doesn't need cake to reward them?
To say the least. Jo, thank you so much in terms of that very careful balance in terms of framing, most importantly, the neuroscience, but also the practicalities of that as well in terms of shifting mindset and that really important bit in terms of creating that new, but actually what's the old stuff that needs to be removed to really enable that as well. So thank you so much for that. You've read my mind. That's literally what I was going to ask for in terms of one of the actions was somebody doing a little bit further research. So I can see you've kindly shared that on screen. Thank you.
Yeah. So there's some stuff that's kind of available on things that we've done. So there's some videos, and also we do kind of workshops on understanding neuroscience for leading change. And there's training. So if people are interested in training, particularly around the change management stuff, we've got some free online learning modules. We can send you the link to it, and also things around neuroscience for change, change management, role of the SRO. Anybody's got SROs that might need some training, just to let you know that's available. And you're welcome to join and subscribe to the HPCA, because it's a community that's open to everybody for free to be a part of. So if you're interested, feel free to subscribe. We've got some great events with some great speakers. Sorry, just
yes, Jo, I'm laughing at the same thing as well.
Brilliant. Thank you for sharing that.
I don't know whether I want to do mine now or not.
Else give it a go. See what other images you come up with.
Thank you. And one thing that I do want to acknowledge in the chat box is actually in terms of our own experiences and actually how we potentially, we've experienced some change in the past in terms of it might not have been in terms of how it should have been. And there is a bit in terms of, and actually practically for all of the great learning today, what is that you can take away in terms of making a difference and make sure that change happens in the right way, and that people lens threads absolutely throughout that, and how can you actually really, really influence that, and how do you role model some of that as well. So thank you to all of the individual speakers. I'm going to bring all of the magically, with technology, bring all of the speakers back into a panel where we've got a bit of an opportunity in terms of questions from the audience. So here we go. If by magic, there we go. The power of technology. Isn't it wonderful, to say the least? So we have all of our panel back, which is fantastic. I certainly have a lot of questions, but I'm minded in terms of I'm going to open the questions out to the audience. So please do raise hands in terms of questions and points of curiosity that you want to follow up on. Please do not be shy in terms of asking those questions, because I certainly got a lot, to say the least. Zoe, if I can come to you first, if that's okay.
Hi, thank you. Thanks so much. It's been really insightful morning. I've made heaps of notes and lots to digest and think about. Just one question I wanted to put to the panel is around the environmental kind of sustainability considerations of utilising AI. So I understand that there can be, it's using a lot of energy to be able to use kind of AI, and appreciate that we need to look at, being as environmentally sustainably conscious as we can within the NHS, meeting the targets that we've got around that, but also, the benefits of AI being able to save, staff time in terms of writing notes and things like that. And it was just to kind of get people's thoughts and views around how is there a way to be able to do, both, so are there certain tasks that we would perhaps be better not using AI for, or just to kind of ask people's kind of thoughts around that.
I've got one on the panel that wants to respond first.
I could come in from like the center's perspective. So, I mean, this is a huge consideration. So thanks for the question, Zoe. So whenever we are picking up a new project, there is a big focus on sustainability aspects. So when we do a benefit analysis, a cost benefit or risk benefit analysis, sustainability appears in all our internal decision making criteria. So like you said, it's a balance, right? How are we improving with the use of this potential new technologies? How are we, utilizing more staff value versus the environmental cost? So it is considered. I'm not an expert on that for sure, but internally we do have experts who would comment on that, who would actually do proper like modeling, like with numbers. It's not just fluff, like with real numbers. What would be the CO2 impact? What would be this impact? And that's kind of taken into consideration, at least for our internal funding in projects.
Thank you.
Thank you, Sophie. We've got one more perspective from the panel to share, if that's okay.
Come in if that's okay, Suzanne.
Yeah,
that's a really good question. It's something not to get complacent on. I think through our governance approach and making sure we're picking the right AI developments, it's something we try and think through in Wigan as well, but it is a really tricky balance to get. I suppose we've just got some practical examples where it can contribute positively to environmental sustainability and helping social work, a conversation to assessment tool I described before. Social workers are no longer travelling back to the house to do this. So there's a helping people spend more time in the neighbourhood, in their patch, walking to visits sometimes rather than driving across the borough. There's been a positive contribution there. But yeah, I think it's just about getting the right governance process and making sure we're really prioritising it and thinking that through for each individual product development. But yeah, it's something to keep thinking through, isn't it?
Thank you both for those perspectives, and also Leanne in terms of practically orientating that back as well in terms of case studies shared earlier as well. So thank you. Paul, can I come to you, please?
Yeah, no, I think firstly, really interesting session, great presentations. Thanks very much, everyone. I've really enjoyed it. I guess I'm curious, I suppose, a couple of questions. So one, do you view it as there's lots of different AI tools and a hospital in the future is going to have, I don't know, 50 different deployments of AI that we hope all speak to each other in a sensible way? Or do we think that there'll be something broader than that that's perhaps not available at the moment that can do a lot of the functionalities of all the different tools? Because I think there's an opportunity here and a risk, I think, which is arguably we could do potentially, and this might be a controversial statement, but we could have loads of different systems which are hard to integrate. And that is kind of, in my opinion, a little bit where we've ended up in the NHS, and a lot of the strategy over the last few years has been trying to unpick that. So is that where we're heading, or is there something that we can do, or will something arrive that means that it can be actually there's one tool or one system that could be rolled out across? And I suppose the other link to that, I guess, is, does that mean that it's every trust could do its own thing in a patch, to take the NHS as an example, which is where I work? And does that actually mean, when you look at a kind of regional or national level, I don't know, is that the right decision? Because, you know, do you actually want to be able to connect some of this unstructured data so that you can learn and see what the patterns are? Lots of questions there, but really good. Thanks.
No, thank you, Paul. I'm really key in terms of actually what does that future perspective look like. Vicky, thank you.
Sorry, my mute wouldn't come off then. Yeah, so I think you're right in the sense of I think there isn't a way to avoid having multiple systems, if I'm perfectly honest. Just looking at the landscape, and also from our experience, you get experts in certain technologies. So like, you really do get expert providers who do, say, a radiology one, or who do a thing, you know, they don't tend to at the moment have those skills in all areas. I've found that, I mean, you'll obviously have your big companies that maybe will then try and have like a package of things, but I think that's why it's so key to get that integration as part of it. So I suppose like when the national standards came out around the ABT, that was one of the key things, is it has to integrate and has to get into that system, which actually I think then helped. So I think integration is going to be key, because I do think you'll get experts and people with such interest in a tiny area that wouldn't necessarily, what I wouldn't want is someone who's a generalist who then doesn't do things well enough. So I think, in my opinion, it might be those varied bits, but just my thought.
Thank you, Vicky. And Leon, can I come to you in terms of that local perspective as well?
Yeah, obviously, so I work in local government, don't I? So like less of a hospital, but absolutely the same principle and challenge. I think it is a real risk. It's a risk that's easier to manage at the moment, isn't it, with our work in its infancy almost, and certainly from an adult social care perspective, it's less specialist than the stuff Vicky described. But and I agree with the reality that Vicky described, that like for me, it's just coordination feels important of the work. So it gets back to your governance and the place in which you do that, because whilst there's a reality, staying coordinated feels important. So as an example, we've worked with one tech provider around a suite of development. So they're all hosted on a single platform now, and we figured out the synergies as we've gone, really. And it's also helped from a data security point of view with that. I suppose like the more different tools you have with different suppliers, the more potential risk there is in terms of data security. So staying coordinated on it, having the right governance in place just to minimise some of those risks and maximise those opportunities, I think.
Yeah, thanks, Leon. Really helpful pointers there in terms of recognising those challenges, but also going back to that importance in terms of the governance as well, and actually how all of that is framed as well. So we can come to you in terms of that national perspective.
Yeah, so I think in my opinion, in an ideal scenario, we are moving more towards agentic AI systems, right? So although there might be different AI small tools that are doing specialist jobs, the user journey would hopefully become quite seamless. With you as a clinician, you're interacting with one tool, as a patient, you're interacting with only one tool, but then it's kind of working in an agentic manner and coordinating everything in the background, you know. So that, I think, this is the area where we are heading, is my view.
Thank you, Zoe. And finally, Joe, can I come to you?
Yeah, I think the connection of the community that's involved in this is so important. One of my first experiences, I went to a King's Fund event, and it was exploring how new technology was being used, across multiple organisations around sharing data and all this. I remember seeing this example from a particular trust and thinking, "Oh, it's fantastic! This is brilliant! They've done an amazing job here of making all of this work." And then somebody from a different trust came up next and told exactly the same story, that they'd got, technology and they'd got this connected and that connected. And I said, Does your approach connect to that organisation's approach? And how much time and money have you both spent on this, and how much resource has been put into it? And you've both come up with the same kind of thing, but they don't actually align with each other. How much money are we spending on this in our own individual organisations and effectively duplicating everything that's going on everywhere, and yet doesn't necessarily connect? I think the Paul's point about the interoperability is crucial. It's got to all connect effectively within an organisation, but an ecosystem as well. But I think being a part of a community that shares the learning and shares what you're experimenting with, so that people can adopt it and not recreate it everywhere, I think is going to be really important. And it helps everybody move faster as well, if you're not having to do all the legwork because somebody's already done it for you.
Thank you, Jo. Really important in terms of, and actually, how do we learn from others? You're in a community now, and this is the point in terms of bringing the masterclass to you. So actually, how can you further tap into this community once you leave this space as well? Grenville, can I come to you for the next question?
Yeah, thank you very much. Grenville Page, non-exec director at the Christie, and I also chair a GP federation in Stockport. Absolutely wonderful and fantastic presentation, and great use of two hours of my time. So thank you very much for that. My question really builds on the previous questions about integration within the system, but it's more than integration within the NHS system and or local government. When you think about the three shifts of hospital to community, of treatment to prevention, and think about the pathways and the collaboration and the drive for neighbourhoods, where you will have primary care, the whole range of primary care, GPs, the pharmacists, etc., charities, housing providers, all that need to really work together to provide the delivery of those ambitions and reduce the avoidable flows into the hospital services. It's integration and compatibility across something that is very, very fragmented, and where many of those organisations probably haven't got the leverage and the capability to develop AI in the same way that the NHS organisations do, or local government. So I think the challenge is quite significant, huge opportunity, but a significant challenge well beyond just the NHS integration or local government.
Thank you, Grenville. A really important point in terms of actually that shift to integrated neighbourhood teams. What does that really mean in terms of the technology and the power and benefits of that, but also recognising in terms of the practical challenges from a resourcing perspective across all of those different sectors as well. Thank you, Grenville, for that. Jo?
Yeah, no, it's a really important question, because it's not a level playing field, because not everybody has the resources, the capacity, the opportunity to engage in some of this work. So I think the formal neighbourhood teams are a really important part for a strategic approach to it from a sector level, and having opportunities for the different parts of the system to be involved with it is really important, so that we've got GP consortium representatives on those groups that's connecting those perspectives in and their thoughts, and the pharmacists and voluntary and community sector. But there's also the associations that support those professions as well. So I did some work recently for the National Pharmacy Association, because they were concerned that community pharmacists out in the high street were dropping like flies, and they don't have the opportunity to connect in with things like this, where they can understand how they could do some of the change, what's going on across their sector. So I think there's two different opportunities there. I think there's a responsibility for the neighbourhood teams to provide those opportunities to come together in a formal way. But also I think there's something about, well, what can you do professionally as a community to come together, share learning, share opportunities to develop, that then supports the whole profession to flourish. That's kind of my perspective on it.
Thank you, Jo. Really helpful. And Leon, in terms of bringing the perspective from Wigan Place.
Yeah, I don't know if it directly answers the question, but it does build on that risk of fragmentation, doesn't it? Just when we're describing a playbook together, how we maximise AI for good in the place, really. I think doing it together is important and reaching beyond organisational boundaries, isn't it? So I didn't describe it very well before, but we're just about in Wigan to try and create a single integrated digital transformation board that or group or partnership, if you like, but in it brings voluntary and community and faith sector organisations too. It brings lived experience and it brings NHS expertise in primary care, the council, but also local businesses, who some of which are kind of like really advanced AI technology companies. So just, and then the local college and university as well. So just the creating a movement of change and adoption of AI together, where we can share those resources and recognise that not everybody has equal access to them, but there's a role to play for us all, isn't it? So I suppose it builds on that concept of integrated neighbourhood work, doesn't it? But maybe not the practical example of health and care neighbourhood teams, but just doing this together feels really important. But it's like, that's tricky to do, but we need to be brave enough to try, I think.
Yeah, really important point, Leon, in terms of actually how do we collectively galvanise this together, bearing in mind in terms of the challenges and risks, but actually what is the art of the possible when we join, and goes back to that sense of community bit as well that Joe put forward as well. How do you make sure you've got the level playing field, but you're actually communicating and you're connected to all of the right partners to enable the right change and the right change for the place as well, going back to that sense of purpose and what are the outcomes for the change as well. Thank you, Leon. So can I come to you in terms of the national perspective?
Yeah, so I think I just wanted to add that we have had a very similar experience on the ABT program recently. Like, the capability and the skill set of deploying a new ABT product within an NHS trust is very, very different to a small GP surgery with not enough skills and capacity from a clinical safety point of view. And then it becomes difficult to articulate. So where does the responsibility sit? So if you don't have the skill set, so who is then responsible to ensure that this new deployment that you're doing is clinically safe? Does it sit at the ICB level, regional level, or the center level? And then when we say it's everyone's responsibility, then I'm afraid it becomes no one's responsibility, because then no one is taking the ownership, and then we get into this trap. So on the AVT particularly, we tried to provide some guidance from the center, but then guidance just isn't enough. We will go and meet people in events and they say, yeah, guidance is great, but like, I don't know how to implement your guidance. I need more. So give us the toolkit, hold our hands to do it, or do something more. So I think if we want this neighborhood model to be successful, we would have to have one entity stand up and take ownership that, we will drive this. And that, I think, is absolutely crucial for this model to work. I mean, way beyond my pay grade, I guess, in the center, but, someone somewhere is hopefully thinking about how we would lead into this neighborhood model.
And so a really important point there in terms of actually, nationally the guidance can be provided, but actually to really enable this transformation and change, it actually needs to be rooted in terms of neighbourhoods and places. And that's the bit in terms of, and actually what's that rooted connectedness into the place, into the people, and also in terms of into the partnerships, into the stakeholders, and really understanding in terms of the bigger world that the hospital might be operating within, the bigger world in terms of that the local authorities operating within as well, and that really bringing to life in terms of the case studies that we've already heard as well, particularly in terms of Wigan Place as well. Thank you. Any final question from the audience? I cannot see. There we go. Back to Paul.
Yeah, I'll make this my last one. I've got lots, but I'll probably reach out to a couple of you directly. So thanks for sharing your email addresses. I suppose, as I think a couple of you have referenced, we've got the keen people that are interested on this call, and I think it's been a really good session. But what is the kind of next step here to kind of create an AI literate sort of public sector workforce? I mean, is there a plan to roll out this kind of training? Is there tools and and approaches. I think we've heard some of those today around how we could try and do this, but how do we, what are our next steps to try and get everyone to a sort of a baseline level of information and knowledge and expertise, so that when they're crossing that bridge that you shared on that diagram, Joe, they kind of understand what they've got the kind of understanding that some of us have gained from this session. Just curious for what people think our next steps are, or whether there is a kind of a national plan for some of that. Thanks.
Yeah, thank you, Paul, and thank you, Vicky, because one of the things that you referenced in terms of your presentation earlier, Vicky, was that culture of AI literacy. So if you're okay in terms of bringing some of that slide, that would be fantastic. Thank you.
Yeah, and probably to raise the point of, I do think there's probably a national approach that we could do to this. And again, we probably do things in different areas. But I think what we've done is a bit of a embedding it into our learning and development team. So it's now part of everyone's mandatory induction training. So we have a section on AI at the induction training to make sure that, like, kind of when you come through the door, this is kind of discussing, here's what the strategy is, here's how we're implementing it, some of the very basics. But obviously that's good. And trying to get on everyone's training. We did mute the idea of doing some mandatory training, but that was quickly scuppered because if we put more mandatory training on, we'll probably get shot, let's face it. So we haven't gone for the mandatory training approach. We are going for the kind of more gently approach. So I suppose we're doing masterclasses there, pretty well attended in our trust. So we just basically throw a Teams event on masterclass, get our comms to kind of, send it out there across the trust. It's open to anyone to join. There's no pressure. They're recorded so people can catch up with them afterwards. And those ones seem to be kind of a way of gently getting people engaged. Then we've done things at divisional boards. So we have each of our CXIOs at a divisional level go to the divisional board. So at least from that leadership level, we can kind of start doing that training at that level. Then we've offered out to services to go and do kind of service level training. So I think it's that kind of, trickle down approach. Whether that'll get more structured, and I do think there's an argument there for probably getting a bit of a almost training matrix and competence where people actually feel at that competency level. But I think we're probably a little ahead, a little before that. We're kind of doing the gently, softly for now, but then we might need to, get that a bit more structured as we go on.
Thank you, Vicky. In terms of bringing from a local organisation perspective at Alderhay, in terms of how you developed that culture of AI literacy, and also in terms of referencing in the chat box, there is a link there in terms of AI virtual hubs with futures, and also Sophie in a presentation earlier on shared in terms of the AI Ambassadors Network as well. So I think both really helpful places to go to in terms of some of those next steps and exploration. Joe, can I come to you for your thoughts on that question as well?
Yeah, I think there's two elements to this. One is what's the capability we need to develop, and understanding what that capability is and who needs it and for what. Because I think it's really easy to say, oh, we need AI capability, and go, why? What's it going to do? It should be a case of, well, actually, what do we need to do? What do we need to change? And then actually, what could support us to do that? I think what Vicky's example gave when she was talking about it was really good, because it had such outcome-focused objectives. It's like, well, we want to improve this, we want to do that. It wasn't about the AI, it was about the outcomes. So we need to start with, well, what do we want to improve, and why do we want to improve it? And then how do we improve it? And that's the bit that then generates, well, what kind of capability, who needs it, in which teams? And so I think it needs to be very much tailored to the individual person and function, and based on the outcomes you're trying to achieve. I think the other thing is that from an organizational point of view, we need to think of this as an organizational change program and plan and manage it as such. It's not a technology implementation. It's an organizational change program. So who is owning that and who's leading on that and structuring that change piece, which is taking people on the journey. Yes, we need the IT to work. We need it to function as it needs to be. But actually, that's a component of it. That's not the big picture. The big picture is, what are we going to do differently at the end of it that adds value to patients and service users?
100%. Thank you, Joe. So, is there anything else that you want to add from a national perspective?
Yeah, so I've added a couple of links. So, of course, from the centre, we're trying to set up these things. But it can be only very generic. As other panel members have said, whatever we bring from the center can only be very, very generic. It cannot be purpose-built for the local and the regional needs. And therefore, identifying that need first is the key step, as Joe was just mentioning. So yeah, and this is still in the build process. So if there's anything specific that you would like us to do more of or less of, then, very happy to have that feedback. The AI team is really active. We're trying to do horizon scanning. So the ambient voice technology guidance came last year. We are now trying to think what is in the horizon, what new technologies are coming, and which guidances would now be needed, because sometimes we are critiqued to say, well, this is too late, so it's good to then try to do some horizon scanning. So some of the work that the team is working on, for example, is guidance on autonomous AI or guidance on AI triage, those kind of things. So it's not really learning platform, but like more in-depth guidance. And if there are things that we can get signals from like our colleagues who are working in the front line, then yes, please feedback, and this would help drive our horizon scanning work as well.
Thank you in terms of that. Thank you in terms of that openness, in terms of that request for the feedback as well. And I would hope in terms of there are some connections that happen with this community outside of the space as well. I'm minded in timings. So just to say some massive thank yous in terms of it has been an absolutely fabulous collaborative masterclass. It really has, in hearing in terms of, most importantly, the governance, but also some practical examples. And actually the importance of what runs through all of this is actually we've heard some great stuff in terms of how some AI technology has really helped and enabled transformation. But actually the most important bit is the people bit. So actually, what is the journey of change that's being created? How are you really engaging? How are you engaging in terms of a place level? How are you engaging in terms of the people within the organisation? And really shaping in terms of what good needs to look like, not just for your organisation, but the wider system that you're part of as well. What does that change need to look like? And how do you really do that in a way that people are coming with you on that journey as well? And we've heard some really strong practical examples around that. And there's lots of great resource links within the chat as well in terms of follow-ups as well. So I would really urge you in terms of engaging with some of the resources. I can imagine in terms of the panel members are probably going to get some follow-up connections after the collaborative masterclass. I could imagine. I can see Paul there smiling and others as well. Just in terms of leading towards the closing, you can see the evaluation is on the screen there. So I would please ask you to engage with the evaluation. I can see some immediate responses in terms of how the session has landed, but if you could share those thoughts with us, it'd be really great. Share future thoughts as well in terms of anything that might be helpful as a follow-up to this session as well would be absolutely fantastic to hear as well. All of the resources from today will be shared with you, so you'll have all of those and the recording that you'll be able to listen back to that, but also in terms of how you can share these resources with others as well that weren't able to connect into the space this morning as well, most importantly. And we've got a very helpful reminder and nudge on the screen as well in terms of if today has been a really great experience for you, you can see when the next collaborative masterclass is. And if you've not already booked onto that, please do before the places get snapped up, to say the least. So I've already thanked in terms of the panel. Massive thank you in terms of behind the scenes to really make sure that this is a seamless collaborative masterclass that's brought to you on behalf of the Northwest Collaborative. So thank you. I hope you have great rest of the days, and I imagine you're all going off now and having some cake for lunchtime, because Joe certainly set the scene for that as well, and there's probably some rumbly bellies for cake as well. So massive thank you, and safe journeys on your way, and enjoy the rest of your day. Thank you, everyone.
Thank you.